Well, September is Suicide Prevention Awareness Month, and it's important we talk about what many consider to be a taboo subject. A new study finds questions used to identify those at risk often fall short. Senior health correspondent Monica Robbins explains why expanding mental health assessments is so critical.
Every time she looks at her arm, Donna Heck finds comfort by her daughter's words.
I love you, Mommy, with her name under it in her handwriting.
Yep.
Donna and Jeff lost Danny to suicide in 2019 as she was making plans to start an organization to help others suffering with mental illness and suicidal thoughts. Now her parents are carrying out her dreams through the 33 Forever nonprofit organization in Danny's honor.
She had a dark moment that she couldn't get through, unfortunately, and that's why we lost her, but she believed that you could.
The organization supported research at Ohio State exploring current suicide screening questions and how they may miss some at risk. The study found gun owners were less likely to report suicidal thoughts, even though data shows firearms are the most common suicide method.
Not everyone experiences suicidal ideation in the same way, and so maybe our traditional ways of asking about suicidal thoughts are incomplete.
Experts recommend amending mental health assessments to include a wider range of questions tailored to the individual, expanding beyond whether they thought about suicide to whether they've also considered a method, which gun owners are more likely to have an answer to.
Just a simple shift in a question, adding one more different kind of perspective or a different angle to ask about suicidal thoughts could potentially help us to identify people who are in a vulnerable state.
So experts say it's so important to talk about this and be aware. Suicidal crises tend to come on suddenly, but they don't last very long. And that's why it's really important to perhaps limit access to a lethal method if you know somebody could be at risk. Suicidal thoughts, much like mental health conditions, can affect anyone regardless of age, gender, or background. In fact, suicide is often the result of an untreated mental health condition. Suicidal thoughts, although common, should not be considered normal and often indicate more serious issues. That seems to be very, very obvious, but a lot of people kind of joke about it every once in a while. You just got to pay attention. It's nothing to joke about.
You know, be aware.
Yeah.
And pay attention more than anything. How prevalent is it, Monica, and who's most at risk?
You know, this is going to scare you. Nationally, it's the 12th leading cause of death. However, according to the National Alliance on Mental Illness, 79% of suicides are male. Although more women attempt suicide, men are 4 times more likely to die by suicide. It is the second leading cause of death among people aged 10 to 14 and the third leading cause of death among people aged 15 to 24 in the U.S. This is why we really need to talk about it. 46% of people who die by suicide had a diagnosed mental health condition, but research shows that 90% may have experienced symptoms of a mental health condition.
Wow,
so
that's alarming.
when you see that, it's very, very frightening. And they're saying about 130 people every day take their own lives.
I mean, I can't even wrap my head around the thought that a 10-year-old would. I guess I understand them thinking that way to some degree based on whatever might be happening in their life, but to actually go through with it?
Yeah, it's terrifying.
A 10-year-old?
Monica, I hate to put you on the spot like this, and if you're not sure, that's fine. There's a lot of anecdotal evidence that suicides seem to be more prevalent since the pandemic. Is there any concrete numbers? Is there any proof that suicides are indeed more prevalent?
You know, the last numbers I saw were from 2020, so
right.
The 130 a day I told you about. But yes, what we do know is that substance use disorder has skyrocketed since the pandemic, and so has mental health. That's why the pandemic shined a very, very bright, glaring light on mental health. So yes, one would assume that suicide could potentially be going hand in hand, especially if 90% of the cases are likely mental health related, but at the time they weren't officially diagnosed.
Monica, thanks.
Sure.